An interesting study caught my eye in the Journal of the American Medical Association, where it used metformin, which is a very inexpensive medication usually used for patients that have pre-diabetes or diabetes. They had two groups with about 50 people in each group, and either gave one group 2,000 milligrams of metformin that was titrated over a 6-week period, or a placebo in the other group, and then followed them for 6 months. These patients all were either overweight or had obesity and had knee osteoarthritis. They used a 100-point scale and asked these patients how their knee pain was. How was the stiffness? How was the pain? And over that 6-month period of time, the patients that were using metformin had a greater decrease in their pain than those that were not using metformin. I think this is really an interesting study. There have been previous studies that have been done that have shown metformin possibly could preserve cartilage when it's been used for a long period of time. We also know that metformin is an anti-inflammatory medication. And we also know in some patients, metformin can help you lose weight. And weight loss, even a 10% body weight loss, can significantly help knee osteoarthritis pain. So, an interesting study with a very inexpensive medication, which I love. In comparison, they talked about in this study that patients that used anti-inflammatory medications like Advil, Aleve, naproxen, and ibuprofen had about the same reduction in their pain as those that used metformin. So very interesting. If you suffer from knee osteoarthritis pain and you're overweight or have obesity, then talk with your doctor about potentially using metformin. Metformin's very inexpensive and has been shown to be very beneficial in patients with pre-diabetes and patients with diabetes to help control their blood sugars as well.